truly a pleasure to host a Health Enterprise Zone meeting in Montgomery County. I have to say we're so grateful to the Lieutenant Governor's office, to Ben Stutz, and to Secretary Sharfstein's office and Mark Luckner for their willingness to respond to our request that a meeting be hosted in Montgomery County, the jurisdiction of the largest diversity in the state of Maryland. So we're pleased. We think it's an appropriate recognition of our county and the work that we do. So we're very grateful. I just wanted to do a brief introduction and to just tell you, for many years, our county has been so focused on the issue of our changing demographics and its implication for the delivery of health and human services. Our integrated Department of Health and Human Services presents a unique opportunity, we believe, to address the social determinants that impact disparate health outcomes. Today, Montgomery County looks very different than it did 10 years ago. Over 31% of our population is foreign-born. Over 50.4% of our population is ethnic minority. Our percentage of school students eligible for free and reduced meals is larger than the public school population of the entire District of Columbia. That's over 46,000 students. And so these facts are impacting our conversation around health disparities in a big way. Why is our community getting sicker? What's the widening gap between rich and poor? And how do we begin to close these gaps for children and families, adults and seniors who live in our community? So 7 out of every 10 Latino and Black adults are either overweight or they're obese. While more white women are diagnosed with breast cancer, 50% more Black women die of the diagnosis of breast cancer in Montgomery County each year. African American mortality rate for those individuals diagnosed with diabetes is more than twice that of the county as a whole. Asian and Pacific Islanders account for half our county's cholesterol rate, and the African American infant mortality rate is almost double the county rate. I could quote similar data for heart disease, for hypertension. The bottom line, though, is that while overall our county is doing well, the health disparities of our minority populations and our subpopulations are glaring, and it's imperative that we as a county act. So, as our state partners know, we have many innovative and creative approaches underway in our community, but strong partnerships with our private and other public partners undergird the work that we do. And we've been engaged in all of the state health reform activities, and to have Lieutenant Governor and Secretary Sharfstein here is just a real pleasure because we've been fully engaged and we just absolutely love the work that they're doing in the direction we're headed in. So we're just very, very energized by the state's approach to healthcare reform, and we're also very excited about the HEC legislation, which when it came out, we saw this bill as an opportunity to further support the public discourse we're having and the concrete work that's underway in our county with our many partners to address health disparities. So we've responded to the draft RFP with our comments and other documents and have coalitions already working in our community to respond for when the final RFP comes out. So these are indeed exciting moments of transformation for us, and we're so delighted to have this conversation tonight and to have you all to come and participate with us.